This year, Sanofi at the ASH meeting, American Society of Hematology, we were able to present data across a number of different therapeutic areas for our BTK inhibitor, rilzabrutinib, which is now approved for immune thrombocytopenia under the name WAY-RILZ. And ITP is it's a disease of complex immune dysregulation, and there are a number of different therapeutic areas, disease areas that have that same characteristic: sickle cell disease, warm autoimmune hemolytic anemia. And so by using a BTK inhibitor, we are able to address this multi-immune modulation across all of these disease areas. So in ITP specifically, where WAY-RILZ is now approved, our BTK inhibitor is essentially a selective, covalent, and reversible BTK. So this minimizes the off-target effects that we've seen with earlier generations of BTKs. And now rilzabrutinib is being studied across a number of different therapeutic areas, as I mentioned, sickle cell disease and warm autoimmune hemolytic anemia as well. After connecting with a number of healthcare providers, patients, including at this meeting, it's very clear there are more options needed in ITP. And so the WAY-RILZ product that was just approved has a very broad label. So WAY-RILZ is approved for adults with persistent or chronic ITP who have had insufficient response to a previous treatment. So it could be a singular previous treatment. That means that we're able to use WAY-RILZ either for persistent, for refractory patients, or upfront as a second-line agent. And in talking to the clinicians, many of them see the highest unmet need in ITP in those patients who are refractory. So they've actually failed either a first-line treatment or one second-line treatment. And this is a great place for WAY-RILZ to be used. However, we're also able to use it, as I mentioned, in second-line, third-line therapy after failure of just one agent, and that could be steroids or IVIG. And even in the early days of the launch, we're starting to see WAY-RILZ being used in both places, in third line, fourth line refractory patients, but also in second line. And in fact, we are exploring the potential for a more robust set of data with BTK inhibition in earlier lines of treatment. So we have an open study called LUNA-4. It's a phase 3b study where we're assessing the earlier lines of treatment with WAY-RILZ in ITP. ALTUVIIIO is a very exciting product. It was approved about 3 years ago, and we are now, and at this meeting, at this ASH meeting, we presented 4-year data. And this is, for those maybe not familiar with ALTUVIIIO, it's a factor replacement therapy for hemophilia A, but it really changes the paradigm in hemophilia A treatment. It's once weekly and also results in higher levels for patients, higher factor VIII levels for patients. So higher sustained factor for longer, allowing for better outcomes. And so what we've seen in the 4-year data that was presented this weekend was continuing improvement in a number of different areas. We've seen continued lower annual bleed rates. We've seen lower spontaneous annual bleed rates, lower traumatic bleed rates, as well as no inhibitors seen in any of the extended trial patients. In addition to that, almost every single patient has stayed on through the 4-year treatment period. And so this is really a great result. We've seen, again, ABRs that are below 1 for these patients, well below 1, with median ABRs of 0 in these ALTUVIIIO patients.